Former U.S. Attorney for the Eastern District of Michigan, legal analyst for MSNBC, and professor from practice at the University of Michigan Law School, Barbara McQuade. And to moderate the discussion, the senior producer and host of CBS 62, Michigan Matters, and columnist for the Detroit Free Press, Cain.
Thank you so much. We're hearing about so many fascinating topics and issues during the course of these days here. And I guarantee you, for those of you who stay here, it's going to be worth your while for the next 45 minutes. We're going to be talking about an epidemic. It's a business issue, it's a community issue, it impacts every single person in this room in some way, whether it's in your family or your neighborhood, your business, it affects everybody. It's about opiate abuse in the workplace. The statistics about this are frankly sobering. Opioids, which I'm using to describe prescription opiates, heroin, synthetic drugs like fentanyl, killed over 42,000 people in 2016. And as Bud reminded me, there's more people dying from that than in auto accidents that year. Gallagher benefits, which Jenny is going to be sharing some statistics with us, talked about in 2016 there were 115 million people misusing opioids, and 70% of workforce have been affected by opiate abuse. We have heard about the famous people who have suffered from this and died from it: Prince, Carrie Fisher, Tom Petty, the list goes on and on and on. But just as important as in neighborhood communities across the land, we have people who are addicted, who are dying from it, and businesses have many, many concerns. I have to be honest and say, when Tammy and Wendy and Sandy reached out about doing this particular event, I was a little bit intrigued because it's not education necessarily, and it's not about the roads, but it's something that impacts people. And they had been hearing from so many businesses about, when they did their surveys, issues, that opiate abuse and the impact, not just today, but going forward, was something that concerned every single person. So because of that, we are sitting here before you today and have four leaders who are at the very forefront of this and are going to share information and thoughts and suggestion and advice. So let me start off, Bud. Penske Corporation. You have, 59,000 some employees. Why is Penske getting involved in this issue?
Well, we've got 45,000 people here in the U.S., and as we've identified this issue, it's really a U.S. issue for us, and as it is for the overall world. 80% of all opioids are used here in the U.S. Think about that. 80% of all opioids are used here in the U.S. So it's a U.S.-centric issue. We got involved because of what we had heard about this epidemic piece. So I was curious to understand what our problem was in our company. One employee is too many, obviously, and I wanted to know what our issues were. And with the help of Blue Cross Blue Shield, with Dan and his team, we use Blue Cross Blue Shield on a national basis here for our company. And with the Gallagher's help also in research, they were able to get us a lot of information. So first it's got to start with gathering information and data, because a year and a half ago, I was one of these, okay? As an employer, you can't do that. So we're not immune to the issue. So first of all, what we did was gather information. And last year, of our 15,000 automobile employees that are here, and their spouses and their children, we issued 2,000 scripts last year of opioids, okay, to 1,300 people. That's number one. So that's the numbers. Then you dig a bit deeper and you say, where is the abuse, okay? They were able to give us information, which you can get yourselves as well, on where the abuse is in terms of number of scripts per person. Okay, and where is that abuse being taken? And I'll give you some examples here. These are crazy numbers. We had one employee, or either their child or their spouse, that had 8,000 opioid pills last year. Divide that per day, right? It's over 20 pills a day. Okay, of 6 different opioids. Got that? 8,000. So are we immune to this issue? Absolutely not. Okay. Another employee had over 3,000 Thermador pills, as well as some fentanyl patches. 3,000, okay, 8 a day. All right. These are issues, okay? Yes, there's chronic pain that needs to be provided. Now, what you can't understand, we don't know who that person is. Through HIPAA laws, obviously, we're not provided that information. What we are allowed to do, though, now is have Dan and his team go out with a caseworker and go to that doctor who's prescribing those scripts, or doctors. We weren't doing that years ago. We can do that now. Two other things we're doing as well, okay? With the help of Blue Cross Blue Shield, the first prescription that a person gets now for opioids is for 5 days supply. Not a 30-day supply like it used to be, it's a 5-day supply, so it makes it harder to get in the hands of that. And by the way, what happens after you stop using that 3-day supply? It goes in your medicine cabinet where abuse happens with your children or somebody else, okay? The third thing we're doing is we're doing a pre-hire screen for drug tests. We've always done that. We've used what's called a 5-panel test. A test for marijuana, test for cocaine, test for PCP, methamphetamines and amphetamines, okay? It didn't include things like codeine. It didn't include OxyContins, didn't include hydrocodone, didn't include hydromorphone, didn't include those type of drugs. As of June 1, we've now gone to a 9-panel test, and we're now testing for those drugs. We're testing for that before it gets into our company to understand that. And by the way, it's $16 a test more is all it is to do that. If we find a few people with a problem before they come to us, we're doing that. So those are the things we're doing that are helping us to understand. But first, it has to be called awareness. You know, and we were one of these. I was one of these until a year and a half ago, and now I'm deep into it to understand the problems and the symptoms and what's going on, and identifying where our problems are, turning it over to Dan and his team to help that doctor understand that that person's doctor shopping. They're going to different doctors. If one turns them off, they're going to somewhere else. Now we're digging into it that way to help our employees. One employee is too many. We've got dozens that need some help.
So Dan, at Blue Cross, which you run, this opiate epidemic, you're at the forefront of it. You, in terms of being an insurance agency, you're seeing all these things coming in here. Your view of the kinds of things that are taking place and what Blue Cross is doing now to try to adjust with it.
Well, I think Bud hit the nail on the head, and I had the same covers over my ears 2 years ago too. Is that, you know, what we can do is be partners with our business partners like Penske and thousands of other businesses, with physicians, with the community. We have so much information, and it's all, to Bud's point, de-identified, but you can look at trends, and we need to take this issue as an epidemic, not over there, but here. Yeah. Because 70% of the workforce is impacted by this issue. And what we try to do is to give the information to our group customers, and they're going to deal with they want to deal with, but you know, also with our providers. Most of the providers, and it's interesting, need to be educated. The community needs to be educated. We're working. We put out $500,000 worth of grants around the state to community-based groups, faith-based groups, to inform the public. The information gap on this issue on opioids is unbelievably weak. We're making progress, but there's a lot more work to be done. And I think our role at Blue Cross is to be partners with the business community, with the provider community, and the law enforcement community, because there is there's clearly abuse, fraud, and criminal activity. It's not in the forefront, but it's part of this. And so we have a multifaceted partnership with all to be able to try to make a difference.
And Jenny, your company deals with the statistics of some of this. Explain a little bit about opioids, because I know this is in the headlines. We're reading this. It seems every day there's another big, epidemic or chain of drugs going on in some city or what have you. How it got to this point, and the addiction versus dependency, that kind of situation with this. Talk a little bit about that.
Sure, and I know we have a limited amount of time,
right.
So I'll try to keep it as succinct as possible. But the opioid epidemic, it came from multiple directions simultaneously. We had misinformation being given to physicians, prescribers of healthcare, saying that these medications were not addictive. We found out later, 10 years later, that information was incorrect, that these were indeed addictive compounds. So these prescription pain medications were being given out for surgeries. They were given out for chronic conditions like low back pain, migraines, chronic pelvic pain, dental pain. And over time, what we found is we had an increase in demand as well. So the general public, as a society, we forgot how to manage pain. We wanted to live pain-free. So we had a demand, we had a supply issue, and we have now wound up with this excessive supply of opioid medications that are in medicine cabinets. They're being used in more of a dependent fashion versus a treatment fashion. And when we talk about opioid dependency, I think it's very important that you understand that there is a difference between addiction and dependency. An individual who is experiencing a dependency on opioids has a physical withdrawal when they don't have that medication anymore. In other words, their body has become physically dependent on having that medication on a day-to-day basis. When they don't have it, they have symptoms, and it's essentially like the flu times 10. It's very uncomfortable, hard to work, hard to function on a day-to-day basis. The individual who becomes addicted to opioid medications or the opioids in general is an individual who cannot eat, sleep, drink, or think without thinking about opioids. It becomes all-consuming in their life, and all they can do when they wake up in the morning is think, where is that next opioid coming from? And it completely takes over that individual's life to where they don't have any identity. Individuals can become dependent on opioids, but not addicted. Individuals who are addicted to opioids are always dependent. There's always that physical manifestation as well. So I think it's important for employers to understand that we're talking about a large segment of our population who started out with a legitimate prescription for a legitimate reason, and over time became physically dependent on it and may not even realize that they are dependent on these medications at all. And so one of the things that I do expect to see coming down the pipeline is we're having more restrictions towards what's being prescribed, more restrictions towards what's being dispensed on the pharmacy side with these prescription pain meds. We're going to see a larger proportion of these individuals coming forward saying, I didn't realize I had a dependency, now what? And so that's where employers have to kind of open their eyes and recognize what do we have as next steps to help those individuals who are going to step forward and say, I think I have a problem.
And Barb, you being the law enforcement expert here, in the state of Michigan, the laws have recently changed effective June 1st. Talk a little bit about how they're changing and what the difference will be.
Yeah, Michigan has done some really positive things leading the way in addressing this problem. In 2015, Governor Snyder convened a task force to look at the opioid problem even then, and that was chaired by Brian Calley, and Bill Schuette took a leading role in that group. And they came up with a number of recommendations, and some of those were some changes in the law, which we're now seeing implemented, including, as you said, some that take effect June 1st, some that have already gone into effect. One is a Good Samaritan law, they call it. When you're with a friend who overdoses, you may be afraid to call the police, lest you get in trouble for violating the law for drug possession. And so there's a law that says you won't be prosecuted if you call for help because a friend is in distress for overdosing, even if you are participating in the drug use with them. So that's a really positive thing. The other is a change in the law that allows prescriptions for naloxone, also known as Narcan. This is this drug that can help counteract the effects of an overdose. It doesn't bring people back from the dead, but when you overdose, your breathing slows down, and sometimes to the point where breathing almost stops. If you can administer naloxone during that crucial period, you can save a life. And so we've had law enforcement officers now carrying naloxone, but this new law says that family members can get a prescription without even identifying a specific individual for whom the prescription is written, and they can just keep it on hand for an emergency situation, which is great. And then the ones going into effect tomorrow relate to doctors. One requires that they have a bona fide relationship with the patient before they can prescribe opioids, which is really important because now some of the cases we prosecuted involve these sort of fly-by-night pill mills where a doctor would just set up shop and write out prescriptions in exchange for cash, or services not rendered and then billing Blue Cross and Medicare for thousands, if not millions of dollars in reimbursements. So that should reduce that problem, if not eliminate it, and restricting the amount of opioids that a doctor can prescribe to an individual to 7 days, in addition to a few others. So I think some of the laws that Michigan is implementing are really going to be a step in the right direction.
We have some local leaders in the state that have filed lawsuits against the prescription companies, Warren Evans, I believe, and Brooks Patterson and some others. There's lawsuits around the country. Will this make a difference at all, do you think, in any of this conversation?
I hope so. You know, one of the reasons that you bring lawsuits and prosecute individuals is in hopes of a deterrent effect. We know that Purdue Pharma, who was one of the first marketers of OxyContin, was prosecuted, but only for a misdemeanor back in the early days for mismarketing and misleading marketing about the addictive qualities of opioids. And I think many in the industry saw that as a slap on the wrist, and they meant that we can do business and there's not much risk here. I think that if there are more serious consequences, my office brought some prosecutions against pharmaceutical makers. I think if they see more severe consequences, then they realize it is a big deal and we need to change the way we're doing business.
A lot of what we're talking about here really is an awareness campaign about this issue. Until you put a light on something, as we're all saying here, it's only the last year or two where people are really paying really close attention to this. So, Bud, from the standpoint of a company, I know I'm looking out here, and yes, there's some big corporations here, but there's also small businesses here. Since you have been really, zero focused on this for the last year and a half, what advice would you give to companies who suspect they may have issues, or they want to make sure they don't have issues? What kinds of things?
Well, I think that, first of all, we're not immune. Nobody's immune to this issue, okay? If you are, then your head's still in the sand, really. I mean, no matter how big a company you are, because it's either it's not your children, it's your spouse, it's your partner, or it's yourself or your partners in your other companies that you may have around you as well serving you. So nobody's immune from this issue. The stigma about opioids is this drug that's out there that we don't know much about, right? That if it was prescribed by a doctor, then it must be okay, all right? Whereas heroin is this dirty thing, right? This thing you're putting into your arm, that this stigma we've seen all of our lives about, it's a dirty drug, right? But here's the facts. 19,000 people died last year of heroin overdoses. 42,000 people died of opioids. Mm-hmm. 42,000 versus 19,000, that's the bad drug, the heroin, okay? The opioids is a drug that is prescribed by people that gets overused and addicted to. So the awareness of the fact that it's out there, and by the way, the awareness of the fact that if you have a problem, okay, as you said, come forward with that problem, okay? Because in our company, if you come forward, we'll help you with it, okay? We'll help you get off it without disciplinary actions or any other issues. Come forward with it in a confidential way. We'll keep it very confidential, do that. Okay, there's other trends we look at based upon the data that Dan provides us. There's a drug called Suboxone. Suboxone is a drug that you use to get off of heroin and you get off the opioids, okay? Through Dan's information, we can see where people are trying to get off themselves. Mm-hmm. We'll see, we got 9 people last year that they provided some information on where 1 month they were taking fentanyl or a Norco, then they took a Suboxone, and took no other drugs after that. They were probably helped off it. But we see some people taking Suboxone, then the next month on Narco, then Suboxone again, the next month on OxyContin. That person's got a problem, right? So you got to dig into the data once again, but you also have to provide your employees an awareness that this is a real issue for you. It's a real issue for us, and a real issue for the employees that may work for you. It's a stigma, and if there's a problem, come forward from a confidential nature. We'll keep it confidential and help you. But that stigma about this heroin thing versus this opioid thing has to be overcome right now. Right? And that's all about awareness and education in my mind.
And Dan, being on the other side of this with Blue Cross's standpoint here, any advice? I mean, you're getting raw data from the companies on this stuff, and I'm doing some sort of a summary of this from your standpoint.
Yeah, I think the awareness point, if you, with a group as small as 20, to a group the size of Penske Corporation, we have data, de-identified data, that can give you an idea of what's going on in your business. You should, whoever insures you, you should ask for it. Right. Because it's in a macro sense, and micro to a degree for your company, you can see that it's going on. The awareness factor, to Bud's point, is very obvious, and there is not an awareness factor. I got into it from a guy I went to high school with that was a dentist, and he said, I got to talk to you, and he talked about what was going on in Macomb County, got me involved with the Families Against Narcotics with Judge Linda Davis. There's now 30 chapters in Michigan, and with awareness and data, you can make a difference. I mean, Bud's a great example. Penske's a great example of that. You know what's going on, you want to help people, and you want to make people aware of what they should and shouldn't do it. And you do that with data. It's data-driven. It's there. Everyone, no matter how small or big your business is, can get that data and deal with it.
And Jenny, since you're in the fact-gathering mode and presenting this and dealing with companies on this, any advice from your standpoint, again, particularly for the smaller businesses that don't have big HR departments, they're 4 or 8 employees and they don't have big resources to deal with this. Knowing the statistics say probably they have this problem here, they may not even realize it, whether it's through absenteeism or what have you. What advice would you give them?
My advice is to start with educating yourself. The National Safety Council has an employer drug toolkit that you can go on to and learn some of these statistics, but also learn what elements of your drug-free workplace policy maybe you need to be revising, what sort of on-site counseling or even your employee assistance program resources. How can you leverage that to better educate your workforce and your plan members? But education really is where you need to start, regardless of whether you can get hold of your data to see how many opioids are being prescribed or not. There's a social responsibility that we all have, and certainly when you're paying for the health insurance for these individuals, I think you have a responsibility to make sure that they're using their health care as judiciously as they can, but also as safely as they can, and getting that information out to understand that it takes as little as 3 to 5 days to develop a dependency on these medications. Now, that's not every single individual, but on average, it could take as little as 3 days of continuous use of these pain meds before you develop the physical withdrawal symptoms and dependency. And so it's getting that education out there to help people understand, get these things out of your medicine cabinets, don't keep them around. There's really no need for them.
I've written a couple articles for the Free Press about opiate addiction. Ken Daniels, who's the announcer for the Detroit Red Wings, has a son who died of opiate addiction and passed eventually from it. And I received a number of emails, tweets, what have you, responding saying opiates are not all bad. They serve a functional purpose. So how, again, in terms of the juggling of legitimate pain, dealing with pain versus stepping over and getting over the boundary where now you've got a problem here. Again, any way to separate and offer suggestions on that?
So again, I'll go back to the National Safety Council, because one of the things that they have advised people to do is to make sure that your employees understand their responsibility for being safe in the workplace. So if they have jobs where they are using heavy equipment, they're moving machinery around, they're doing some sort of technical skill where being less than cognitively present, because that's often what happens with these opioid medications, is they can affect your ability to think, process, your reaction time. If using these medications on the job could be a safety concern, your employees have a responsibility to come forward and say, hey, I need to be on these medications. Here's why I'm on these medications, but I also want to be safe because I want to be a responsible member of this workforce. And again, having those plans and policies in place in your workforce to support those individuals to come forward. I heard the message about trust that we're talking about. And I think that is part of what needs to happen, is you need to be sure that you have that culture of trust within your organization, that those individuals do feel safe to come forward, ask for assistance.
So Barb, you being in law enforcement, being in a situation where you have people before you, you're sentencing not just companies or what have you, but individuals who have these problems here. Is there any anecdotal, because again, this is all about, we're raising awareness now, as raising so people know more and understand a little bit more about it maybe than when they came into the room. Are there any points you would want to make about people who have this addiction, who end up before you, they've got some major issue going on, end up criminal justice system for whatever reason here? Anything you can draw conclusions from that?
Well, so many of the people that we were prosecuting were the distribution networks, and there are many people out there who will exploit this vulnerability because they know it's very profitable. Selling pills on the streets. They know that people sometimes turn to heroin, so selling heroin on the streets. Mixing that with fentanyl, which is a man-made opioid that is far stronger than the pills that you would get and can lead to fatal overdoses. Sometimes using carfentanil, which is an animal tranquilizer. It's cheaper for them to distribute it that way, but a dose of that can be fatal, which is why I think we see so many overdose deaths. But when it comes to individuals, I think that the focus really needs to be on treatment and prevention and to view these people as victims. I have heard it, I think rightly said, as some criticism of law enforcement, that in the 80s, when it was the crack epidemic, we locked people up. But now that it's opioids and it's affecting white people, we talk about treatment and prevention. I think that's a very valid criticism, but I think we're doing it right now. Our mistake was then. And so when we see people who have fallen prey to this, they're victims, they're vulnerable victims, and I think treatment and prevention is a much better remedy than incarceration, because if you lock someone up, you can stop them from using the opioids, but the treatment they need is so all-encompassing. It involves, you probably know this better than I do, Dr. Love, but behavioral therapy, cognitive therapy, because opioids can alter the brain. And so if you just lock someone up without giving them the support treatment that they need, you see so often the day they get out, they revert and often engage in a fatal overdose because they've never really had the appropriate treatment that they needed.
Yeah. So Dan, since you're in the whole state here, I was reading some material and it said that Michigan is 10th among states in prescribing opiates. I don't know about overdose deaths, where it stands in the ranking, but is Michigan?
18th.
18th, okay, thank you. Is Michigan, we have a bigger problem with it than other states, and what would you attribute it?
Well, clearly based on the statistics. And I think, to your earlier point, I think nobody's arguing about pain management and correct pain management. But that's not what we're talking about here. We're talking about abuse. We're talking about an epidemic that affects all of us. And so when I hear the reactive mode of those that are prescribing, I don't buy it. I think generally you find that physicians, once good physicians, are doing the right thing. I think we need to continue to focus on this. I think the Families Against Narcotics, you've got municipalities now, to Barbara's point, where they're not locking people up, they're giving them help. That's what we need to continue to do. And I'm really actually enthused about the impact that the awareness campaign is having. The interface that we're having with the business community, I think, is really having a significant impact. Our numbers are down. When you look at our statistics over the last 2 or 3 years, our numbers, prescribing numbers, are down about 20%.
So another thing that we've heard a lot about is doctor shopping, going around getting different things. How much does that go on from?
I think the doctor shopping is going to be less of a problem in the next 2, 3, 4, 5 years or so because of the restrictions that are happening from professional licensing boards as well as state licensing boards. There are retail pharmacies that are restricting how much they will dispense at one given time. So I think we're seeing that excessive prescribing starting to ratchet down. And I think that's going to be less and less of an issue. But again, it brings forward, well, what about the individuals who were taking these pills on a regular basis, developing that dependency, now what for those individuals?
And I think these new laws are going to address just that, Carol. The laws that go into effect on June 1st, Friday, one of them requires this bona fide relationship between doctor and patient before a doctor may prescribe opioids. That will address that. Doctors are now also going to be required to enter medications into an electronic database. Yeah. We've had the database for years, but it was sort of optional for doctors. Yeah. They're now going to have to enter that data in there, and so they can access it and query it and see if this patient has been prescribed opioids by another doctor in the recent past. So I think that will help. Those are some of the laws Dr. Loepp is talking about that will help address that problem in Michigan. I think
e-prescribing it continues to make a difference. Yeah. To Barbara's point, that you can see that we're working with the Michigan Hospital Association, the Medical Society, the Osteopathic Society, and the Safe RX program to continue the awareness for docs, for hospitals on this. And I think the more electronic we get, the easier it is to watch and the better it is for society.
Are you optimistic? I mean, since we're now talking about this, the problem is getting more attention, certainly. Is that making a difference in not just here in Michigan, but nationally, and raising the conversation about this to help avoid some of these issues and problems?
It is for us just by raising it as an awareness, okay? Communicating it to our associates. This is an issue that we have internally. It's just not everybody else, out there, your customers or somebody else's family. It's us, okay? And when I give some of these examples that I just mentioned regarding these numbers of pills, the numbers of scripts being written for one individual, 8,000 pills somebody took last year, the lights start going off saying, that's one of our associates or one of our members in our company that actually did. Yes, that was us. It wasn't somebody else, it was us. So those kind of issues and those kind of examples start setting the tone for our company to say, yeah, we have an issue. And just the awareness of this, once again, top down, which is what's been driven our organization for myself, and then hopefully bottom up, have been an issue. And the other thing we talk about too is what we can do individually ourselves, okay? And one thing we did was this. We said, tonight, when you all go home tonight from work, go to your medicine cabinet. And what's in your medicine cabinet? Okay, it's probably 2 years ago when you went to the dental, okay, you had an extraction or a tooth pulled, or you had a broken leg, or 3 or 4 years ago, that OxyContin or that Narco or that morphine still sitting in the medicine cabinet. Would you all agree? You probably are guilty of that. I was, okay? Let me give an example I talked about when coming up here. I live in Birmingham. There was an open house down the street from us a couple weeks ago where all the reloaders come to an open house. The person came back home, and somebody had stole all the opioids from the medicine cabinet. They didn't go through their jewelry.
Jeez.
Went through their opioids and stole the opioids out of their medicine cabinet. Is that crazy? That's in Birmingham, Michigan. Okay, so we told our employees, go home tonight, get rid of your opioid. And what do we do with them? We can take them back to your pharmacy now and get rid of them versus flushing them down the toilet, right? So those are the that's all about awareness though, isn't it? Right? It's all about awareness to your associates and to your people and to your families as well too. I told my wife the same thing. We probably got them in our medicine cabinet, and sure enough, we did.
Yeah. And to your point, one of the phrases that I've heard that's resonated with me with this topic is, if it's mentionable, it's manageable. And part of it is breaking down the stigma that's associated with this and really talking about it. The more you talk about it, the more you're going to see people come forward wanting to talk about it as well. I had 2 conversations in the airport yesterday with 2 random strangers. Both of them had very strong opinions about what is happening with opioids, in particular that they felt, they live in inner city Detroit. They said it is not an inner city problem. It is a suburbia problem. It is the workforce problem. And in fact, that's what the statistics tell us, is that out of the individuals who are abusing opioids, 2/3 of them are employed. And we often think about this as being a socioeconomically disadvantaged problem. But in fact, 2/3 of those who are abusing opioids are employed.
One resource I would mention, if people want to just raise awareness among their own employees, a very easy way to do it on the cheap is the Drug Enforcement Administration came up with a video about a year ago. It's at DEA.gov called Chasing the Dragon, and just raises awareness. It includes some statistics. It chronicles the stories of 5 users, how they got started on their addiction path. And it's a good place to start if you just want to. It's an easy way. You can send the link to your employees and have them take a look at it. It's about a 45-minute video.
We're talking about businesses here, but also, Dan, you mentioned faith-based and other initiatives that you're helping with as well in this conversation. Any anecdotal information about that? Other organizations beyond the traditional workplace, maybe?
Yeah, I had a great meeting with Archbishop Vigneron and a couple of his auxiliary bishops about getting the message out in the Catholic Church. We've met with the NAACP and the same, because if you can do this back in the neighborhoods, in the churches, and again, back to what we've all talked about, this awareness factor, that people just weren't paying attention. And one of the best ways to get the message out is through the churches. There's no doubt about it. And and we spent a lot of time with information, grants, publications to get that message into the churches. And it's, I believe, making a difference.
Optimism about this and raising the awareness of it. Do you think, are we making an inroad here?
Yeah, I think so. I think in just the past, I'd say 5 years or so, I've seen a huge increase in the awareness. I think doctors have become very aware of it. I did a presentation at Michigan Law School, and the professors there were very keen on the issue. So I think the awareness has set in the medical profession. I think insurers, and I think employers is probably the next obstacle that we need to overcome. There are some like Bud who are very on top of the issue, but I think many who just haven't given much thought to it, that it's our problem. And so I think that's our next bastion to
How do you
cross.
overcome the stigma which comes when you over these kinds of issues here? There's a stigma to it, there's no doubt about it. So Bud kind of alluded to that a little bit about, well, it's not a them problem, it's an us problem here. How do you get past the stigma within an organization of addressing these issues and not labeling someone because they raise their hand saying, yes, I have this problem? How do you get past that?
Yeah, I think one thing is sharing statistics, that it's everybody's problem. This is a problem that knows no demographics. It affects every age, every race, every group. And also, I think, Bud's pointing out that there are people in our organization. We might not know who they are, but it's us. It's our family. It's our team here. So let's support each other. So I think that might be one way of destigmatizing it, is recognizing that it's not them, it's us, right? Whoever them happen to be in that situation, it's everyone's problem.
You're all at the forefront here of this conversation, but have other companies reached out to you knowing that you're this is a sweet spot for you and Penske?
Perhaps after today.
All but Denker.
It's interesting because we use various self-providers in the city, from whether it be Henry Ford to Beaumont and others as well too. And I'm a great example of that. I broke my leg earlier in the year, and my doctor was, what do you want me to do? He didn't want me to have any pain, right? Have no pain. So I got morphine and OxyContin as a drug to get myself off this pain, right? But if you've ever taken those drugs, you know how weird they make you feel in terms of just your overall sense of mind. And I couldn't get off it fast enough. And after 2.5 days, I got off it, but I had 5 days left to go. So get rid of those drugs, I would say to you all, back to your home. But really, it's a matter of getting back to the education of this thing. It's a piece that I didn't know much about just a couple of years ago. It's easy to understand with the help of your providers like Blue Cross Blue Shield or wherever else you have. Use them. The data is available. You'll know if you have a problem or not. My bet is there's probably a situation for all of you out there in your organizations. You probably do have a problem out there. You don't understand it now, but once again, find out and provide those employees an awareness and a path forward before it's too late. Okay? Before it's too late means absenteeism, lack of quality of work, okay, accidents. Okay, those things are all going to lead to probably dismissals or discharges sometime in the future. Catch them before that's a problem. Help them get the support they need to get off this drug, because so often they can't get it off themselves. They need help. Mm-hmm. Opioids are worse to get off than heroin. They're worse to get off than heroin. If you read about it, you'll understand that. And as a result of that, people need help in getting off these drugs than probably just themselves in doing it.
Carol, I think the progressiveness in a company like Penske of sort of eliminating the stigma to say, listen, there's a problem, we want to help you. It goes a long way to people dealing with it, and not avoiding it. And I think, it's a great lesson for small, medium, or large-sized businesses. And I think seeing that makes me feel that more and more are going to do it, and I think that's great.
Yeah.
Mm-hmm. Yeah, and I would say some of the clients that I've been able to work with and look and start to talk and discuss this topic with them, many have gone back to their EAP programs. And I know that is one of the ways that the EAP, the Employee Assistance Programs nationally, are starting to evolve themselves, is to look at how they can be more supportive to the employees or to the family members of the employee who may be going through this particular dependency as well, and leveraging their technology either through telemedicine, through telecoaching, through teletherapy. They're making access more available. They're breaking down the barriers to it. And so I think it's important for employers, when you're looking for those solutions, how do I get ahead of this? Make sure that you have that pathway for people to, again, ask for that help and have it there ready to go.
In this big brother environment of the government having all this information, or companies having information on you and looking in your computers at what you're looking at, that sort of thing, how much concern is there to people not getting help because of that, because they don't want people knowing that?
Well, and again, I think that goes back to that culture of trust.
Yeah.
And do you have that trusting environment within your workforce, going forward to educate the employees, having training programs for your managers and your supervisors on how to recognize misuse in the workforce, but also how to have those crucial, compassionate conversations with someone rather than it being an accusatory or conflict-oriented conversation, literally training up your staff how to have those crucial conversations with individuals, and then having a step-by-step plan that you share with your employees, with your plan members. Here's how to access the care. Here's what we will do to support you if you come forward, rather than we find out through a positive drug test.
What if it's not necessarily the employee, but someone in the employee's family, a son or a daughter, husband, wife, what have you? Does that change the conversation here again in terms of helping awareness? Because even though they may be missing work because they're dealing with a family member with the situation here.
Right, and I think there it's making sure that your health plan has opportunities and coverage for those individuals and reevaluating, making sure that it's there. And then again, getting them a clear line and a clear pathway how to access that care.
Is there a conversation about awareness of young people? In other words, now we're seeing it now more in the headlines, adults are seeing this more, we're hearing about it, but helping to reach down to younger age people before and about this and educating them. Does that play into this conversation too?
Yeah, in fact, one of these new laws we just talked about in the state of Michigan requires the schools to teach kids about the dangers of opioids. So I think that's a big part of it. I know there are organizations like the U.S. Attorney's Office and DEA who are going around to schools and teaching young people about the dangers of opioids. There's also one of the new laws requires doctors to talk to parents to get informed consent before children get prescribed opioids. And I have a son who, when he was 14 years old, broke his ankle and was prescribed hydrocodone. And so I didn't feel it, but I think because I knew enough not to. But how many other parents would do what the doctor told them and get that for their kids, right? So I think educating young people is a really important part of this conversation because, as we know, kids are prone to experimentation, and they often think, as Dan said, that if the doctor prescribed this medicine, it must be okay, right? It's different from other drugs. It's not like a street drug. It's medicine. So how bad can it be for me? You know, you hear these games of they call pill roulette, where they put a bunch of pills in a bowl and pull one out and take it. You know, it's so incredibly dangerous. And so I think educating young people is a really important part of it. So that's something that employers can take upon themselves as well, providing information for their employees to take home to their families.
How much more physically dependent or vulnerable are young people to these kinds of drugs here? Any statistics on that?
Can't quote statistics right off the top of my head, but what I will say is, when you talk about you're not going to fill an opioid prescription for someone with a broken ankle, there are other things that you can use for pain management. And some of the research that's coming out now, we're finding out that Tylenol and ibuprofen back to back are equally, if not more effective than the opioid pain medications. So just, not filling that prescription isn't denying somebody pain management. There's other things that can be done that are non-habit forming.
So I know we're winding down on time, and I know we've talked about a variety of different issues revolving around this opioid conversation, but I know coming in here, each of you had a point you wanted to make about something. So if you can just take a quick minute and give a quick synopsis or a point you'd want to reinforce that people can take away from this. And Bud, since you started, why don't you start on this?
Well, my point is don't be like I was, just a short time ago, a year and a half ago. That's where I was. I was ignorant to this issue. I knew this was an epidemic, whatever that means, but it was somebody else's problem, frankly. And I would say when you get back in your office, ask your human resource manager, or ask if you're self-owned, take it upon yourself to ask your service provider, whether it be Blue Cross or Blue Shield or somebody else, to assist you in the data. Understand, look at the data you have available to you. They can get that for you to understand the number of prescriptions you have per employee, the number of overall prescriptions issued last year or whatever it was, a time frame, and look for trends and look for issues. And then also take it upon yourself personally to look at yourself in the mirror and say, what am I doing about it to prevent it myself and my family? What's in my medicine cabinet? What are your kids, what can possibly your kids get into? The worst fear we have of any of us in this room, right, is your children to get into this issue. Yeah. That's the worst fear any parent has, and I'm including myself, to get into this issue. And I've been able to educate my two sons as a result of what I've learned over this issue as well, too. Hopefully it's helped them raise their awareness. So get back and look at yourself, at your own companies, your own organization, and that's where you have to start with your provider. They have the information, they can get it for you, and you can be educated yourself. It doesn't take a rocket scientist, which I'm not, to understand more about what this issue is about.
And I think, ask us. We cover, one out of every 2 people in the state of Michigan has a Blue Cross card in their pocket. Ask us. We have the data. We want to share it with you. Again, it's de-identified, but it shows trends. And if you can see the trends, you can educate people. The other end for us is to educate our provider partners. We have 99% of all doctors in Michigan and 100% of all the hospitals participate with Blue Cross. And so part of our obligation is to educate providers, but ask us, because we have the information. We can help. We can work with you. As individuals, you can go on our website. We have a toolkit that you can look at. There's plenty out there, and we're here to help. And I think, you know, the leadership of companies like Penske, you know, the hands are off our ears now, and we want to do something about it.
Jenny?
I think this issue has just barely pulled back the curtains on what could be happening within the U.S. workforce, and that is that we have a lack of resilience and an increased likelihood of burnout happening within our workforce and a society in general. And we have to start thinking, what is the root cause potentially to this opioid epidemic, and is it people are self-medicating themselves because they're having a hard time dealing with the stress of day-to-day living and lacking that capacity for resilience. And so I encourage employers to think about, how are you supporting your workforce in the resiliency so that they're not needing to turn to these substances of abuse or alcohol or benzodiazepines in order to just handle their day-to-day life.
Barbara?
Well, to employers, I guess I would say this. I remember when I became U.S. Attorney, someone gave me the good advice that if it's important to any of your employees, then it should be important to you. And so I guarantee you there is someone in your workforce struggling either with their own addiction or the addiction of a loved one. And if they are, they should know that there's a place they can turn for help. And so making it clear that you have access and resources available to them, they will be dealt with compassion, I think goes a long way. We know that there are a number of people not in the workforce because of addiction, or as you said, Dr. Loepp, because they can't pass the drug test. So there are lots of people out there struggling with this issue, and if it's either your employees or family members of your employees, help them by providing resources to them to help them deal with the problem, by destigmatizing it, and recognize the reality that there are just thousands of people dealing with this issue, and very likely one in your workforce.
All sage words of advice. Great advice from all of you. I want to thank you so much for taking time to talk about it. Hopefully people in the audience learned a little bit more about this epidemic and something that you might be able